And in my own experience working with patients who have had abortions, they tend to come in terrified to even talk about it to begin with. They're afraid of stigma from me about it. And so they'll often talk about it in political terms to start with. They'll announce their political affiliation of being either pro-choice or pro-life, and then start to talk about it. And so just making sure I'm aware of how their language is being presented and making sure I follow along with that. Okay, so some common values for patient-centered care. It's extremely important to follow patient language, particularly on this topic. So, how a patient might talk about anything related to reproduction. They could be talking about infertility or pregnancy loss or abortion. Are they using terms like fetus? Are they using terms like baby? And following the patient. When we insert our own language into the conversation, we are inserting what our worldview is, and that does have an impact on patients. So we want to be very aware of how patients are talking about their experience. And in my own experience working with patients who have had abortions, they tend to come in terrified to even talk about it to begin with. They're afraid of stigma from me about it. And so they'll often talk about it in political terms to start with. They'll announce their political affiliation of being either pro-choice or pro-life, and then start to talk about it. And so just making sure I'm aware of how their language is being presented and making sure I follow along with that, focusing on their experience rather than whatever legal implications that might be. So rather than focusing on, oh my goodness, if they're talking to me about abortion as a negative experience for them, am I feeling in some way reactive to that? Is that trying to indicate some legality about abortion that they might be trying to communicate? And no, instead, just staying really focused on the patient experience and resisting my own bias and to create some counter-transference experience. So, for example, if a clinician is hearing a patient talk about abortion, let's say it's a therapist who has a personal pro-life perspective, and they hear a patient talking about how abortion was freeing for them and empowering for them. If they feel triggered in some type of way about those comments from their own personal advocacy around the topic or their own personal beliefs about the topic in a political or legal sense, their response might be different, might be to push back against that rather than hearing the patient fully through. And vice versa, if a therapist is coming from a personally pro-choice point of view and they're thinking about the topic from that perspective rather than the patient's perspective, if they hear a patient talking about wounds from abortion, they might be more likely to diminish those wounds rather than hear the patient out and what their experience has been. One way to really focus the patient is to be curious about their experience. So rather than responding with statements, responding with asking questions and really leaning into those motivational interviewing skills that we all are taught through grad programs, and maintaining a commitment to all patient dignity and all patient inherent worth. So what patients' experience have been, whether it's about abortion or any other topic, does not diminish their inherent worth as a human being or their dignity as a human being. So staying really true to that concept, no matter who the patient is that's in front of you. So a little bit of history on politics and abortion, specifically related to counseling. I'm going to skip to the second bullet point here to start with. In 2012, there was a paper written about the politicization of abortion and the evolution of abortion counseling. So this is specifically about counseling prior to an abortion, not after. And it was a really interesting read on how initially when abortion clinics first started to open up, counseling in abortion clinics was much like counseling in a therapy setting, where there was full exploration with a patient about what was going on in their world, who their social supports were, why they might be seeking abortion, was there obstacles to pregnancy, were there obstacles to abortion, just fully exploring the patient experience to make sure the patient felt fully informed and fully sure of the choice they were making. And over time, as the abortion industry grew and became more politicized, the counseling became more of a here's some information about abortion and more of kind of a sales pitch. This isn't all clinics, but a large portion of clinics became more of the people providing counseling prior to the abortion weren't actual counselors. They weren't clinicians. They weren't even the doctors. It was maybe someone in admin at the clinic who was doing the abortion counseling beforehand and really just following along the checklist that lawmakers had created for whatever state you're in about what needs to be communicated prior to the abortion rather than doing actual exploratory counseling with the patient. So that paper is a really great source if you want to look into the history of how abortion counseling prior to abortion has evolved over time. In 2014, a young woman named Abigail Ryder put out a thesis where she studied clinicians who had both had abortions and were counseling women who had abortions. And it was a really fascinating read on how those clinicians both managed their own experience of abortion within the counseling sessions and how they helped patients stay focused on the patient experience. She discussed whether or not they did self-disclosure, how counter transference might have entered the room, how most patients have very multifaceted responses to abortion, and those can change over time, and it can be impacted by what else is going on in their life from the moment of abortion till the present time. One consistent theme throughout, whether it be the clinician or the patient, was a sense of grief and guilt at one time or another throughout their experience after the abortion up until the point of therapy. So the vast majority of women experiencing both of those. And again, that not being indicative of anything that we need to consider legally, just based on the patient experience, what might they need and support if they're having those experiences. And then in 2021, another young woman released another thesis, and this was a study done in Canada. And this was from a religious perspective. So she was looking at this from a patient who had had an abortion who also would have some type of religious affiliation. It was multiple patients, it wasn't just one, but and how they might experience counseling in that session. And it was really interesting to see the difference between patients who were coming, strictly speaking, some kind of religious content within their counseling experience and patients who may not be. These patients had a completely different experience of countertransference than the patients who weren't looking for a religious um, component to their counseling. So, as an example, patients in the first study, the first thesis with counselors and that had had abortions, that were counseling women that had abortions, the countertransference they saw most often might be a pro-life therapist having a negative reaction to a patient who had a experience with abortion that they framed in a positive way. And so that would be the countertransference she was seeing more often. And this, it was more often the other way, where a patient had had an abortion and really felt grief over the loss of what the patient identified as a baby and experiencing more pro-choice therapists really struggling with the patient having that experience at all, any wound from abortion, but even beyond that, the therapist, with all good intentions, truly well intended, trying to make the patient feel better, saying, you made the best choice you could at the time, which those patients reported actually really invalidated their grief and their own accountability over what they felt was their choice and how they needed to recover from the wounds of that choice that they had made. So completely different experiences of countertransference, but from two different pieces. And then there's a book that was written on choice processing and resolution as a way to counsel this particular population, as a way to resist and validating grief while also increasing focus on choice, not just choice back when the abortion occurred and how that patient might have felt about, did they even feel they had a choice, but what went into that choice then, but also their choice to heal now and empowering them to be able to heal now.